Hi everyone. Welcome to our educational seminar about dental implants. Change your smile, change your life.
Tonight we're going to talk about all your different options in terms of changing your smile, whatever it might be. There's all different things that can be done, and I'm a general dentist. I just happen to do a lot of different things, and so that's the advantage at our office. Is you may find out that that you're a great candidate for implants, or you might not. But either way, we can help you get a smile and have a good function either way. And don't worry about that black spot. That's an X-ray there. It shows someone missing some teeth. But the things that happen to us physically when we lose teeth, number one is that you lose bone with the teeth. You also, when you lose teeth, it's that hyperextending is you start moving your teeth in different directions. You move your jaw to try to adjust for those missing teeth, and their teeth are shifting. You have periodontal disease, which is gum disease and bone disease. You lose bone, you lose gum. It changes your bite. You end up having gaps between your teeth because when you take a tooth out, if it's left that way, it's kind of like books on a bookshelf. You take a book off and things kind of just slide like that. Same thing happens in your mouth. Another thing that people don't realize is your sinuses up here. If you lose upper teeth, what happens is your sinuses start dropping down too. You actually lose bone between your sinus and your jaw. And then TMJ, what's that? That's jaw joint problems. So if you're shifting your jaw around, it can mess up your jaw joint as well. So you may be sitting there and thinking, wow, it's bone loss and all these things, or maybe you're thinking, maybe I'm too old for this, or maybe I'm too young, or whatever. Age is not a factor. HIV positive, your just body isn't going to be good for that. Pregnancy, good thing about pregnancy is it tends to work itself out. So if you're pregnant now, you can probably do it later. Uncontrolled diabetes. A lot of people have diabetes now. I think it's 1 in 7 people have diabetes. So we treat a lot of people with diabetes. It's just if it's uncontrolled. So if people with diabetes have infections, and we don't like infection around an implant that's trying to osseointegrate. So that's important. One thing for the implants themselves, the teeth can wear out. Like, those of you who wear dentures, you're chewing and the teeth start to wear down. So they can wear out, but the implants themselves will stay there. And when it comes time where you wear out your teeth, you can make another appliance that fits right on those implants. They're not going to go away. They're a lifetime procedure. We offer sedation in our office to do it. I've had some people that do it without. We use local, whether you're sedated or not, we always use local anesthetic. A lot of people think when we sedate people that we don't give Novocaine. We definitely still give the Novocaine, but you just don't remember it when you're sedated. And again, I love calling patients after we put implants in, because usually the report is good. They tell me how great I am. They tell me I'm Superman. It doesn't get any better than that. And it just depends on your case about what your investment would be for your mouth and how much bone loss you have. There's things called bone grafting. We do some bone grafting. If you've lost bone or you have a tooth out, it's going to be a little while before we put the implant in. We actually can put bone grafting material in there to help you preserve the bone until we can actually put the implant in there. Sometimes we use oral surgeons here in town to do the bone grafting. Depends on what kind of teeth, if you're doing bridges or removable appliances. And what I'd say is that if the lowest possible cost is something that's your deal, then dental implants probably aren't going to be for you. But we have some other options that we've talked about tonight. And sometimes that might be just a transitional thing. You might say, I know these teeth are bad, maybe I'll start off with a partial denture and then we'll move that way. And so if we have a plan, we can help you. And I just want to help you at any level that you are. But we've really worked with different financing options for everybody to make things affordable. Nobody's really come in and just come out and just, paid the cash like that. I haven't found those people. But we have a few people we suspect might be drug dealers that pay us in hundreds, and we still have some old-time farmers that pulled it out of their bib elbows and do the hundreds too. They have it in some box on their farm somewhere or something. But most people have to do some sort of a financing plan, and we're used to that. And that's what Teresa that started out here, that's what she's a specialist at. If you have dental insurance, she knows how to work with that as well. Okay, so there's just a lot of ways to make it affordable. You guys received basically a little flyer that entitles you to a free office consultation. We'll do whatever, and everybody's different, so it'll be whatever it takes. So if we need to take certain x-rays or whatever, we'll just do it. If you need the scan, we'll do it. And then, like I said, I spend a lot of time just really looking at your case and saying, okay, here's what your options are, here's what you can do, here's how much it's going to be, here's how much time it's going to take, all that stuff. And that's all complimentary that we're doing that. I want you to really know what your options are. And if you choose to stay with us, great. We think we're one of the best places, not only in town, but probably in the country, to have your dental care taken care of. Have life-changing experiences with dental implants and a lot of things that we do in our office. And the biggest complaint that I get afterwards, and I've had literally people stand up and grab me by my lapels on my clinic jacket saying, well, why didn't you make me do this earlier, doctor? And I was like, I told you. Yeah, but you didn't really tell me. So, so that's the biggest complaint we have.